Therese Coffee's interview, I'm not sure whether I'll get copyrighted for this, but as I'm not actually showing anything, and I'm telling you who it is, LBC, Nick Ferrari, and Therese Coffee, and this is a car crash interview from this morning.
Ukraine in a moment now to events here in the UK, and dominating so much of our daily lives is, of course, the aftermath of COVID or the pandemic. How is the backlog of operations to be beaten? Well, community diagnostic centres, CDCs, apparently is the way forward. And here to tell us more is Health Secretary and Deputy Prime Minister Therese Coffee joining me. Sorry, Deputy Prime Minister, good morning. How do these
So, hang on a minute. You're telling me we're going even more American? We're having CDC now. CDCs, but we've now got the CDC in America, in Britain. Like, the Tories are bang set on us becoming American.
CDCs work? Good morning to you.
I thought the Tories were supposed to keep things as the status quo and be traditional and be British. That's what I thought.
Well, we've already opened about 90 already, and that gives us the capacity to do about an extra 2 million tests, checks on people, and we're opening 10 more in the next few months. That's the plan from the Isle of Wight.
I do hope one gets sent down here.
To Burnley to Birmingham. And
that's up in a straight line.
What this does, recognising that there's about 7 million backlog.
And it doesn't even go far north enough.
And about just under 2 million of that is the getting diagnoses. And these are an important way of making sure whether people need understanding whether people need treatment at all, or what kind of treatment.
Okay. Yeah, I get this. This makes sense. Is it going to be properly funded? Is it going to be properly staffed? How long is this going to go on for?
They might need. So we've opened up the capacity to tackle those backlogs, and I'm delighted to be going to Wood Green later today in order to formally open one there.
Where do you site them? Where do you find the space?
Well, they're in a mixture of different places. Sometimes they're in shopping malls, as we've got one today. Sometimes they may be attached to existing hospitals. So the point is...
So what? Them mobile clinics? MCs! They're MCs.
That we try and make sure that they're in the community where it's easy to access.
At least it's different from America. Instead of calling them CDCs, you can call them MCs. Mobile clinics. Makes sense.
Easy to, in effect, almost not quite drop in, but you can get referred from whether it's your doctor.
And is this gonna sort out the backlog, or is this just one facet? What effect is this actually going to have?
Pharmacists or hospitals, and the intention is that people can go and get a much more convenient way of getting that diagnosis. So opening up capacity, getting those results quicker, and allowing people to either get on with their treatment or have the relief of not needing treatment at all.
Well, that's tremendous. The best of luck to you and your colleagues trying to bring you that about. While I have the benefit on the line, I have to share some other, perhaps rather gloomier news. We look at the nursing profession, and they're being balloted for strike action. I've just spoken with someone involved in now balloting.
More strike action, right? Now, you notice the nurses are balloting to strike, okay? Unions aren't telling nurses they have to. Nurses are wanting to. At least they're looking to want to. So the unions are looking to facilitate that. Listen to her response.
Ambulance service workers in London and East Yorkshire and other parts of the East Midlands, Yorkshire. Is there a autumn or winter of strikes in the NHS? What are you going to do about it, Deputy Prime Minister?
Well, my predecessor accepted the independent pay review body, and that's what we are honouring. I'm conscious the unions are looking for more than that, but I think we've taken a responsible approach in honouring that independent pay review. And on
that's not going to solve it. Which predecessor was that,
£1,400.
Which predecessor was that? Because there have been a number of health secretaries.
Oh, sorry, I think it was Sajid Javid.
Right. I mean, I'm going to start giving you numbers because you go so...
You think it was Sajid Javid? This is your brief. This is your brief. You're not supposed to. Oh, I think it's Sajid Javid. It was Sajid Javid. Or whoever. Not, I think. You're supposed to know this stuff. This is typical of Therese Coffee. She is just as bad on camera, maybe, as Dizzy Lizzy. It's ridiculous. I'm going to have to come up with a name for this fucking twat as well.
Quickly, it's probably best to call you number 3. What are you going to do to actually try and avert the strike action, though, Therese Coffee?
Well, I think we're not going to be.
I think yeah, this girl's fucking really good on the camera. She's popular. She also looks like she's been smoking really strong salvia at fuck knows what time in the morning.
Able to change the pay settlement that we've already announced. I say it was what we accepted from the independent pay review body, but I'm aware and that these situations are can be challenging. That's why the government is already acting in different ways to help people with the cost of living challenge.
That's not what.
It's why we are today repealing the health and social care levy. So instead of it being individual taxes, that this support for the health and social care gets paid from general taxation. And indeed, the amount of money we've already given, £37 billion was already set out, particularly focused on low-income families. But the extra support that we are giving to households and indeed to businesses and indeed hospitals with the cost of energy. And people are seeing that impact already in the helping to bring down inflation forecast estimates, but also the challenges that people were facing with their business budget.
I am 90% sure I just heard a very bored Nick Ferrari in the background sighing his ass off then. That's hilarious. You're boring. That's hilarious. It's funny, all of this bullshit towards Keir Starmer of, oh, you're boring, right? It sounds like Nick Ferrari falling asleep listening to Therese Coffee.
Budgets as well.
All right. You feature in one of the newspapers
again,
today, The Guardian.
That wasn't the question he asked, but fuck it.
It is reported that, yes, it's reported that the plan to tackle smoking, the action plan to tackle smoking, has been shelved. Is that correct, Secretary of State?
I'm not aware it's been shelved. I've been focusing on my ABCD and going in.
You've been focusing on your alphabet, have you? I get that. I'm not being stupid here. I'm just being facetious. I get that this is probably something. Yeah, I recognise it from somewhere, but I get that it's probably something official. But it sounds like I'm remembering my ABCD, and it's like, no, you remember. You forget the E.
Into more detail on how we deliver that.
So
there's a number of prevention programs across the Department of Health. We're looking at
not what he asked, you drunk-looking fart.
Number of those activities and how we keep focus on that longer-term program. But
it was a yes or no question.
Immediate challenges.
Binary. I'm not so big a fan on binary, but still, it was a binary question.
Are focusing on building on the NHS winter plan. That's why we've got things like the £500 million discharge fund.
It's not what he asked. You ramble. I know why I ramble, right? But she's rambling at a yes or no question.
To help people get to the right place for them to have care, rather than necessarily being in hospitals. So we're working very effectively on those top.
Effectively, blah, 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 blah.
Priorities.
So just to clarify, the action plan will go ahead?
Well, I'm not aware of any changes to be made.
Yes or no?
I'll be looking in the next few months at all our different prevention programs, seeing what's potentially working, seeing...
Yes or no?
How many things there? There's quite a lot of things in draft at the moment and working that through. But my top priority is where the majority of people in...
You're Erne.
Interact with the health and social care today.
But you're still on track to make Britain smoke-free, by which the proportion of adults who smoke needs to get down from 14.1 to 5%. You're still on track to do that by 2030.
41.1.
I cannot give you a view right now because I haven't looked into this specific
general view.
prevention policies. But
yes or fucking no, you stupid twat.
there's no particular reason I'm not being told that we're off track, but I'm not being told
Yes or fucking no.
anything
But you would
specifically about
support
the
that,
programme
would
at all.
you, Dr. Coffee? You want to see Britain what's known as smoke-free, do you?
Well, I think there's an element here about
How did she get to her doctor? Did she actually study to become a doctor or something? Was she a doctor of?
prevention is better than
Wait a
cure.
minute. I can find this out. Hopefully. What is Therese Coffee a doctor of? She has her doctorate in chemistry. Chemistry. Just solidifying this. Because that means that she is not a doctor in the way she's trying to come across as. She has a PhD in chemistry. That doesn't make you a medical doctor, love. She attended Somerville College for a single academic year where she studied chemistry and rowing. She started University College London with a BSc in chemistry and awarded a PhD in chemistry in '98. Worked for Mars Drinks, but as a finance director. So this woman has no... This is hilarious, right? This is hilarious. She's part of the 14.1%, which is why she's giving such a fucked up answer. And I'm pretty sure I'm being stupid here because I'm pretty sure I've seen a picture of her drinking and smoking at the same time. And it actually says here, she enjoys gardening, smoking, karaoke music, smoking. What is Nick Ferrari asking her about here? Of course she's dropping it. Therese Coffee is a hypocritical fucking twat. She is having people call her doctor because you didn't hear that when she was the secretary for the Department for Work and Pensions. All right, I never heard it. Now she's health secretary. Now you're hearing it. But she's not a medical doctor. She's not a medical doctor. Like, it's. I wonder how many people noticed that, by the way.
And as I say, there are existing policies out there, whether it's a combination of obesity, about
Right.
Now, of course, you don't want to fucking focus on it because you smoke and you're rather large.
smoking as the source of many other diseases that people face, and understandably, we want to have a proactive, positive prevention program as well, and that's where
Waffle,
other ministers
waffle.
are focusing on that, and I will be turning my attention to that once I've got much greater detail and grip of the agency.
It is a yes or no, Secretary of State or Deputy Prime Minister. Do you commit to trying to make Britain smoke-free by 2030?
Well, that's the policy of the government as it stands today. That's the policy. Well, I'm the government minister.
Yes or no?
So if that's government policy today, then that's what I agree with.
You do.
So you're a doormat?
I don't have personal views on these.
You're the fucking health secretary. How can you not have a view on fucking smoking? Like, God's fucking damned.
Sorts of matters. They are government policy, and that's what we will continue to focus on.
You do think smoking is dangerous, don't you?
I think many people smoke in this country.
Nick, she smokes.
Knowing it's a potential source of all sorts of different problems that can bring health
I can't wait to see if Russell Howard picks up on this one.
Challenges immediately or indeed in later life, and that's why we have a more general prevention approach in trying to make
Which obviously isn't working for you or for me, to be fair, but still.
sure that we have a healthier nation.
Why did you vote against the outlawing of smoking in cars containing children?
I'm sorry, I'm just going to rewind that a second.
Smoking in cars containing children.
General prevention approach in trying to make sure that we have a healthier nation.
Why did you vote against the outlawing of smoking in cars containing children?
All sorts of different problems that can bring health challenges immediately. I think it probably did, but
I think it did.
I'm not getting into necessarily.
And you've referenced this, the number of medical.
Absolutely.
But you see,
I think the law did get changed so that people.
if you're driving children in a car, you think it's okay?
Oh, I think you'll find that the law. I can't recall now if the law changed or not. I think it probably did.
Government.
In trying to make sure that we have a healthier nation.
Why did you vote against the outlawing of smoking in cars containing children?
She voted against it.
Oh, probably because I didn't think it was the right thing to be doing to telling parents how to handle the situation.
The health secretary voted against a bill. Now, I smoke, okay, but I wouldn't smoke in the same vehicle as where a child is, unless I know that smoke is going directly out the window. And even then, it's like, I'd rather get out of the car. She's the health secretary.
So you think it's right to smoke in a car if you've got children in the car?
It's like having Boris Johnson as chief secretary of the Treasury. What the fuck?
I think you'll find that the law. I can't recall now if the law changed or not. I think it probably.
This is horrific. She is the health. She's not just a health minister, okay? She's the health secretary and the deputy prime minister. This is not good advertisement for women in power.
Well, he did.
To which I'm not. It's not like I'm not against women in power. It's just this is not great advertisement for it.
But
I think it did.
I'm not getting into
But do you think
necessarily
it's right?
prescriptive.
If you're
We want a
driving-
positive prevention program in the
Oh, we don't want the nanny states. No such fucking thing, you retard.
future.
If you're driving children in a car, you think it's okay to smoke?
And no, I am not going to apologise for using that word.
Just to clarify.
It means backwards. She's being backwards. I'm calling her backwards. She's retarded.
Well, I think I don't know what the law says today. I'm a Democrat, Nick. I think the law did get changed
No. You're an idiot.
so that people shouldn't be smoking in cars. But that's.
And you agree with
You're
that?
asking me something from a decade ago.
Well,
I'm
I'm
not
just
quite
interested.
sure why it's relevant
you don't
now.
seem as you don't. You're so empowered with your ABCD.
2 seconds. My little sister.
You have it with a passion, and you're determined to drive this.
Absolutely.
But you seem a
Because
little
that's
bit
the majority of
relaxed
how
on
people
smoking,
interact with
but
the health
yeah.
and social care, Nick. And
Okay.
I'm not quite sure where the obsession of smoking has come today.
Well, I just
But
interested to-
there we go.
All right. Should we
As
talk about?
part of your brief, your health secretary and I think Nick is having a bit of a jab at you.
And you've referenced this, the number of medically fit hospital patients who are stuck in hospital amid shortage of care workers. The one newspaper, the Daily Telegraph, has done an analysis of NHS data. 6 in 10 patients assessed as well enough to leave are not being discharged. You have referenced this earlier, so it's a problem that's in your sights. How do you hope to tackle that?
Well, one of the things we're doing, we've announced a £500 million social discharge fund, and we will be deploying that through the local NHS and working with councils for this winter.
Borrowing is how she's going to do it.
We know that there's huge variation across the country, and that's why the role of the local NHS through something called integrated care systems is so important. It's not going to be...
The social care system should not be made private in the first place. Yes, okay, you can make private healthcare system. There's a private healthcare system anyway, but why is the social care system private?
be a one-size-fit-all approach right across the country. It's about taking...
No, you fucking retard. Oh, we're just going to do... We're going to do this and make it so it works for everyone across the country because I'm sick and tired of thinking anymore.
Individual things that are happening in specific hospitals with specific local authorities in order to unlock how people, or make sure that people are treated in the most appropriate place.
On the subject of hospital beds, there's some research done by the King's Trust. I'm sure you're aware of it. Do you know how many beds there are in England at this time?
There's approximately 105,000, principally 100,000 roughly in what's called acute hospitals, and about...
In a population of 50-odd million.
5,000 in community.
Nowhere near enough, dickhead.
Well, sorry, I misspoke. It's the King's Fund. They have a total of 140,000 in total.
So she's 35,000 off on... Why is she health secretary? She's not even a fucking doctor!
That's significantly down. In the late 1980s, it was 299,000. So if you allow...
Right.
I'm sorry, I'm just going to rewind that a second.
At this time...
There's approximately 105,000, principally 100,000 roughly in what's called acute hospitals, and about 5,000 in community hospitals.
I misspoke. It's the King's Fund. They have a total of 140,000.
So you have no idea what you're talking about.
That's significantly down. In the late 1980s, it was 299,000. So if you allow...
Right.
just to finish, sorry.
Just let that soak in a minute.
If I may, Deputy Brian, for my listeners, so we've gone from, it's some years ago, I accept, but all but 300,000 to just a whisker over 140, at a time when obviously the population has grown. Surely that's...
Because the Tories have shrunk the NHS.
Something that needs to be addressed. Deputy Prime Minister.
Well, the UK National Health Service is actually world leading in.
Oh, how very typical Tory. Point out where they're going wrong, and they'll tell you that, no, you're wrong, that's not wrong, we're the very best in the world. Oh, no, Britain's the very best in the world. I don't know what you're talking about. Oh, there's something wrong with the NHS. Oh, what are you talking about? NHS is the best thing in the world. There's something wrong with it. Yeah, but it's the best thing in the...
Treating and operating on people on a day case basis, as it's called, far more than many other countries, and particularly in Europe. So it's been a change in approach that was done deliberately so that people stay in hospital for the minimum amount of time needed rather than
Deputy
extending.
Prime Minister, are they? We've just discussed how 6 in 10 patients are still there when they can go home. So this is, if I put it to you, a double whammy. We haven't got as many beds as we had before, and those we've got are being occupied by people who should be at home.
Boom, motherfucker, answer that. Like, properly answer it.
Well, I'm conscious about the capacity issues. That's why also I think we're opening up, in effect, about 7,000 beds. That's a combination of more wards being open.
No.
But also, excuse me,
Are you all right?
also the opportunity to have
Sorry, I just need a minute to think.
remote wards as well. And
I forgot what I was about to say next.
what that means is that people can go home, they can be monitored from afar.
It's not happening though, is it, you fat twat?
Seeing improvements in technology.
And I'm not fat shaming here, I'm being literal. She's a fat twat.
All the time. I think it's Watford Hospital.
She's trying to insult my intelligence. I will insult her. I don't give a fuck.
Where the average stay at home now is people returning to hospital once they've been released is under 10%, whereas on average the NHS plans that half of people may go back within a month. So it's those sorts of improvements that we continue to see. I'm conscious about the...
Right. Waffle. And yet it's still getting worse.
The challenges on capacity of beds. That's why we've got some focus happening right now at a much more local level to try and unlock some of those problems.
But just lastly, you reference other countries. Just lastly, Deputy Prime Minister, if you allow for beds per 1,000 population, beds per 1,000, United Kingdom stands at 2.45, Germany 7.9, Austria 7.1, France 5.9. We're less than half of France. Why are we so lamentably low in the number of beds per head?
Because the Tories don't give a flying fuck about the NHS. They didn't want it in the first place.
Well, I've just pointed out that the UK is actually world leading in doing safe.
But it isn't, is it? He just pointed out to you that we have less beds per 1,000 people than comparative countries in the EU when it comes to medicine. So obviously we aren't, you lying fat twat.
Same day treatment, and so it's a desire of the NHS, my understanding, to not keep people in overnight if they don't need to be clinically. So we've made some changes.
What are you doing about it? Was the fucking question.
Different ways, of course. We will continue to work on making sure that we have appropriate capacity.
Another non-answer.
And that includes certainly trying our focus on trying to get people home who don't need to be in hospital, but more importantly, making sure.
These are all things that these are all things that you're saying you want to happen. What you're being asked, you fucking idiot, is what are you doing? Not what are you looking at doing, what are you doing? Simple English.
Sure that they get the care and treatment they need, absolutely, as patients.
Grateful for your time with your two briefs. Thank you. Secretary of State for Health and Deputy Prime Minister Therese Coffee appearing here on LBC. 1 minute after 8 news is next.
On your...
That was tedious. That was entirely tedious. And I am not the biggest fan of Nick Ferrari. I think he's an entitled cunt Tory supporting Brexit stupid twat, but obviously he does have experience of this. It's like Andrew Neil, you can't get everything wrong. And he put her on the spot here, and she's not a real doctor, not the way she was getting him to call, you know, the way he was calling her like it. God. She's our health secretary. Just like Jacob Rees-Mogg is the business secretary. That's where we are now. Oh fucking shit. We have, like I said, I smoke. And I'm not ashamed of it. I smoke. But, like, if you were health secretary, you'd make sure you know about this shit. I don't know why you asked me about smoking. Oh, because it's to do with health, and you're the health secretary? You fucking moron. Half an hour long rant for a 12-minute long video. But it just... I could not help myself. I'd love to be put across the table from some of these people. I'd like to tear them a fucking new one. I really would. There should be more out today. I plan on doing maybe one or two more. I hope everyone has a good day. What are we? Dinsdag? Dinsdag. So, I hope everyone has a good Dinsdag. And I hope that more funny shit comes out. So, we take piss out of. Bless the Thursday, and this has been the Shadow Vita with my Dorkviska. And yes, that's me going Old Norse, Old English, Old Norse. I'm sorry. Have a good one. Bless the Thursday.